It's a pleasure to recognize the only pharmacist, I think, in the entire House of Representatives, Mr. Carter, for his 5 minutes. Gentlemen.
Thank you, Madam Chair. I have to correct you, though. We have another pharmacist now. We have 2 pharmacists in Congress now.
Well, that's great.
One of my colleagues has given me the
distribution.
Yeah. But I am the oldest pharmacist in Congress, if it matters. So, nevertheless, thank all of the panelists for being here and discussing this extremely important subject, obviously. Governor Levin, I wanted to start with you and just talk about the distribution process. It's so vitally important. And one of the critical aspects is to pharmacies and to pharmacists, making sure that we're utilizing retail pharmacists, whether it be independent or chain pharmacists, is extremely important. As has been mentioned during this hearing, 95% of all Americans live within 5 miles of a pharmacy. Pharmacists are the most accessible healthcare professionals in America. We need to utilize that, and I think we would all agree with that. HHS has made some changes to authorize pharmacists to be able to administer the vaccine. In fact, early on, during this pandemic or during the administration, the distribution of the vaccine, the administration of the vaccine, they passed a rule where that pharmacists could give it to anybody 3 years or older, and that was very important. And just yesterday, they also passed a rule to say that the vaccines can be shipped directly to pharmacies, and that is very important during this pandemic as well. I wanted to ask you, Governor Levitt, you've served at the state level, you've served at the federal level, as have I. I've served at both levels as well. And is it your belief that all pharmacists should be able to administer the COVID-19 vaccine if it's approved by the FDA, no matter what the state laws may be, no matter what varying state laws they may be?
I've referenced a couple of times in this hearing my experience with Medicare Part D, which is another moment in time when millions of people all at one time were seeking some type of new federal or new government service. The pharmacies were they were the heroes of that whole effort, because people went to the pharmacy, they knew they could get good advice, they knew they could find out the answers, and I became a great supporter of that. And I think they are a great support in the annual flu. Typically, that's I get my flu vaccine. Now, I personally would not go so far as to say that the federal government has an interest in being able to override local decisions that are being made on what's best in every community. But I think many communities are and will realize even more how important that connecting to your important statement is in being able to serve those communities, particularly the underserved communities.
And I would agree with that. And thank you, Governor, for that point. One thing that I wanted to point out, and I'd be interested in knowing your opinion on this as well, is that during this pandemic, we've both relaxed some rules and implemented some new rules. And one thing that I hope that we do at the federal level is to review this before we just go and put them all back into place. I mean, there are things that pharmacists can do that they need to be doing, not just during this pandemic, but they need to be doing the whole time in order to improve healthcare services here in the United States. Governor, another thing that I wanted to ask you.
I concur with you. Having pharmacies operating at the top of their license, being able to do all of it.
Absolutely. I represent an area that has a high minority population as well. And it's very important and very concerning to me about vaccine hesitancy, particularly in the minority community. Just wondering what your experience is, what works, what doesn't work, just some advice, if you would, on how we can improve that.
I think he's having difficulty. I'm glad to jump in on this question.
Yeah, please do. Thank you very much.
Sure. So I think in addition to the challenges with people accessing the vaccine for our communities of color, there are also challenges with vaccine hesitancy because of distrust of the vaccine, because of mistreatment in the past or discrimination in the past. People aren't trusting the vaccine itself. So it is really important for there to be community efforts where there are trusted messengers from within the community, engaging with the communities to understand what their questions are, what their concerns are, who they want to hear from, so we can actually address the concerns. So when vaccine becomes more readily available, communities that are highest risk actually have more access to it, and their concerns are addressed. And
that is so very important. Thank you, Doctor, for mentioning that. And I, for one, as a member of the Doctors Caucus and as a congressman, I went through the clinical trials myself to try to set a good example. And I was fortunate enough to be able, of course, it was a double-blind study, but I did get the vaccine. So I want people to know that it is safe and effective. Thank you very much, Madam Chair, and I yield back.
Gentleman yields back. It's a pleasure